So, Dr. Khalsa, I observe this philosophy. People often say that diseases are genetically linked. So, diabetes passes to the next generation. And here was an observation: if your family is eating certain kind of food, they have a certain kind of practice at home, it's obvious that the children are going to follow the same. So, genetics is not usually the genetics per se, but also the lifestyle which you adopt from your parents.
Yeah, this idea of genetic propensity for certain vulnerabilities and weaknesses is certainly there. I mean, we all have very different genetic propensities. And some people, I mean, the most common one is that a woman who has ancestry with a long history of breast cancer is much more likely to get breast cancer. And, you know, in modern society, this is sort of viewed as, oh, that's it. You know, you've got this genetic propensity, you should have your breast removed, you know, because there's nothing you can do about it. Well, as we know, we can actually change our gene expression. So we have these genes and those genes are inherited. You can't change the gene structure that you have because that's your inheritance. But you can change the activity of those genes. So if you have genes that are leading to a propensity that might lead you to a higher risk of developing breast cancer, you can do behavioral things that can reduce the activity of those negative genes. And we know that because we now have evidence that we can increase the activity of genes involved in immune function by practicing these types of mind-body practices. We can downregulate the genes that are involved in inflammation by these practices. So we can affect our gene activity. So even though you might have a propensity in your genetic makeup for a certain disease, you can counter that with a proper lifestyle and proper mind-body practices.
That's very insightful because we usually believe that it is genetic. Many patients, when we receive, they say it's genetic, it runs in my family. It's not possible that we can really cure it. So I think it's a myth breaker.
No, absolutely. And I think people underestimate how much influence they can have on their own internal functioning. This is one of the most fundamental concepts in the field of mind-body medicine. And that is the idea of self-regulation of internal state. The ability through these practices to control our internal functioning, to make a difference in our internal functioning. And this is a concept that's just simply not present yet in modern medicine. In modern medicine, the doctor treats you. You go to the doctor. The responsibility is all on the doctor. In fact, it's even gotten to a more gross level where the patient says, no, I'm going to sit on the couch all day long and watch TV and eat fat foods and do whatever I want because, you know, that's my right. And if I get sick, that's the doctor's responsibility. If I get type 2 diabetes, I expect the doctor to give me a pill to fix that, and then I'm going to go back and sit on the couch and do what I was doing, because that's my right as a human being. We've gotten to that level of relationship to our own health. The responsibility for health should be on the patient first, not on the doctor. The individual must take responsibility for his or her health care. That is true preventive medicine. I mean, we do this with our cars. I mean, who owns a car but never gets an oil change? You know, the engine's going to fall out. You're going to lose the car altogether. But we treat our bodies this way, our bodies and our minds. So this is the whole idea of prevention and health maintenance, that doing these kinds of meditative and physical practices in mind-body medicine can sustain our health and prevent us from having to deal with these diseases.